Hello dear patients, today we are going to review the case presented on the picture. This is Chancre-form pyodermia. A 27-year-old patient came to us and ulcer developed on his genitals. This ulcer was quite dense, it was painless. This ulcer was covered by a purulent deposit, he washed it away at this moment. This ulcer had a meaty fundus. Also, inguinal lymph nodes were enlarged. They were palpated, but they were not painful. According to the patient, the ulcer developed after he squeezed his sexual organ twice with a zipper of jeans. This was a provoking factor, this trauma. It appeared twice. The patient likes to wear jeans, and it happened so that he squeezed his sexual organ by a zipper of jeans. So, indeed, in such cases, we need to think about such diseases as syphilis, herpes, and rarer diseases in some cases. So, first of all, analyses for syphilis, herpes, HIV, hepatitis B and C of blood were taken. Secondly, smears were taken from the surface of ulcer for all sexually transmitted infections, PCR analysis. Also, culture tests were taken from the surface of ulcer. As a result, on the surface of ulcer and on penis, all PCR analyses were negative, including different types of herpes, syphilis, etc. In such cases, it's very important to take analysis for herpes zoster, because I have met several cases when herpes zoster was the cause of such ulcers. However, in this case it was all negative, and more than 34 different PCR analyses were done for the patient from one smear. So streptococci and staphylococci grew in culture test, and the preliminary diagnosis of Chancre-form pyodermia was set. So analyses were taken again, blood analysis, in a month, in 3 and 6 months. However, all blood analyses for syphilis and herpes were negative. So it was finally established that this is Chancre-form pyodermia. A course of external and internal therapy by antibiotics was done. Levomicolum ointment was prescribed. Injection antibiotics were prescribed for 2 weeks. Medications that speed up epithelialization and enzymes by type of longidasa were also prescribed. As a result of that, the surface of this ulcer gradually scarred and a white scar developed. As I said, analyses for syphilis were negative. In such cases, the most important thing is to exclude syphilis, herpes and other sexually transmitted infections, and Chancre-form pyodermia appears quite rarely, rather as an exclusion during dense ulcers on penis, painless ones, as in our case. If any ulcers develop in the area of sexual organs, you must consult venerologists to exclude sexually transmitted infections. Also, you can consult venerologists of our clinic. We are waiting for you. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.